Good morning, everyone. We've heard from Roy, and he's obviously very enthusiastic about his technology. I want to thank the folks from the Center for Innovation for the invitation here this morning. But let me give you a little bit of context about what would a company like ours be doing, being out on the leading edge around this virtual consult activity. It was just short of a year ago from today that I had the opportunity to take the job as CEO of the Blue Cross Blue Shield plan in Minnesota. And I probably don't have to remind you that the economy had just tanked and healthcare was a little bit in the crosshairs. So a few people said to me, "Great timing. Aren't you excited about that?" And my reaction to it is, couldn't be better timing. Couldn't be better timing because we have a platform for change. The opportunity and the ground for innovation could not be stronger. And we must act with urgency. So I would put to you that we are not today your mother and father's Blue Cross Blue Shield plan, and we are moving rapidly and have made many changes in the course of a year's time. For context, when we think about ourselves, we talked in our strategic planning about we were an insurance company that was focused on a claim. We were a health plan focused on delivering cost-effective care to an employer who was buying that service. And where do we need to be and where are we going? We are a health company. Our focus is wellness, prevention, and better outcomes when care is needed. And that's how we talk about our company, and that's how we think about the things that we do as we interact with the folks that we deliver services for. So when we think about health and health care, and there is a distinction, and we make that distinction every day, we think comprehensively about how do we interact with the folks that we provide insurance for. First, we think about the individual, and how do we deliver directly to the individual. So health risk assessments are a critical component of the programs that we sell, and we try and sell health risk assessments to all of the companies that we interact with because we think this is critical baseline information that needs to be active in driving the system. So that's certainly one of the components. We've also talked about, when Roy mentions benefits, we think it's critical, and we're trying to promote everywhere we go benefits that allow for a premium reduction when an individual is managing their numbers, right? So you ought to be getting something back for doing the right things. And that's a kind of program that we have with a number of large employers now, and it's something that we as Blue Cross employees have in our program and something we're trying to encourage into the marketplace because we think it gets the right kinds of behaviors. We also think online care and the virtual consult is something that has come to be a real opportunity in the marketplace. So we didn't want to be shy, we didn't want to be last, we didn't want to see somebody else out in front. We were willing to take the chance to get out in front on this. The first customer of online care will be the Blue Cross Blue Shield employees and their dependents. So that will be a 10,000 employee and dependent group, and we will be on the cutting edge with American Well and using that as a focus group. So we tested ourselves. When we go to the marketplace, each and every employee of our organization will say, we use this for ourselves. So it's an important thing to be in front of your customer and to also be engaged in that activity. At the core, we see this as respecting the provider of care's time. That time on the phone, we heard from many different providers that often I bring somebody into my office because that's where I get paid. Now, I know that there's plenty of times that people are seen because that's the appropriate way to deliver care, but there are plenty of opportunities, as Roy was touching on, where care could be delivered in this online setting, and it would be more convenient to the patient, more convenient to the physician, and frankly, from an employer standpoint, they are thrilled about this. They are very excited about the idea that the amount of productivity they gain by not having somebody who spends half a day tied up in the medical system because they had an online transaction and can be at work that day, as opposed to absent from the workplace. This is something employers are very excited about. I've talked to many of the biggest employers in our state about this program, and the first question they have is, when are you through your pilot so we can roll this out? So this is something that's coming, and it's coming fast, and there's a tremendous amount of interest in the program. But I want to build the broad context about what our company is focused on and how online care fits into this wellness and prevention orientation. Obviously, many of you are aware that we won a settlement against big tobacco a number of years ago. That has led to great results in the state of Minnesota, working with all of you, of course. But Minnesota now stands first in the nation at 17% of our citizens smoking, where 22% is the national average. Blue Cross Blue Shield members in the state of Minnesota, 10.9% smoking. And we have set as a goal for our organization to take our membership into single digits. And we incent our management team against that number. So we've taken the sort of the traditional view of an insurance company and said, that's not what we're about. We do pay claims, we do insure people, but what we're about is driving towards better results, prevention, and wellness. And if we believe that, part of how we compensate our folks needs to be about what do we do to reduce the use of tobacco in our community and to reduce the problems brought on by obesity. And so those are two elements that we compensate our team for, the results that we are able to achieve in our membership against both of those activities. So when we think about our comprehensive view, we started with the individual, absolutely critical to focus in on the individual. But it's also important to think about the family. And it's probably not something I have to remind any of you about, but when you're talking about compliance to drug regimen, when you're talking about doing the things you should do, the family support is critical to how a patient interacts with the healthcare system and how they focus on wellness in the first place. So this is a very important component that we have definitely incorporated through many different ways. Actually, it came to us earliest through our foundation and all the work that our foundation does in some of the underserved communities, particularly those around the Twin Cities, but also around the state. And we have seen that the social determinants of health are absolutely critical components to the wellness and prevention activities that we want to focus on. So making sure that our message is understood in that family environment and making sure we understand the context around the patient is absolutely critical. So here we show a couple talking. We all know that it's typically the woman in the household who's driving healthcare decisions for the family. It's just the way it is. And that is a very important component to the way we think about the delivery of health and health information to the family unit. We also are focused on nutrition and nutrition information, nutrition counseling, and how to get people to take care of themselves in the first place. This is not just about the care once they're in a condition that they have to deal with. We're trying to get more and more information out into the hands of our members. They need to hear these messages from as many angles as possible. The Worksite. It's obvious that the Worksite's a place we're all spending 40, 50, 60, 70 hours a weekend. This is a place that absolutely needs to be impacted. So today, we're reaching out to the employers that we cover. If they've got a cafeteria, we want to consult about how they should set up their incentives inside their cafeteria to incent the use of the right foods in that cafeteria setting. How do they lay out their campus? Do they make active lifestyle a part of how they think about their workplace? And we're demonstrating to them how those dollars can come back to their bottom line when they make the investment in health and wellness. One of the things we announced recently at a Healthy Communities forum that we hosted in the Twin Cities was a program called Nice Ride. We are going to have bicycles all over Minneapolis starting in the spring. that can be rented, and there will be kiosks around the city to make a lot of that downtown congestion relaxed, and to take people and give them the opportunity to run that lunchtime errand by renting a bicycle and moving around the Twin Cities. This is a program we hope to take far beyond Minneapolis, but this is the first of its kind in the United States. It's modeled after what's happening today in Paris and in Montreal, and the ridership there has been excellent. And it's really about thinking comprehensively about the community and how do we bring the right practices. Certainly going to smoke-free workplaces, absolutely critical and a part of this program. And as we think about communities, the city of Rochester was one of the winners of the community awards for what we call complete streets, thinking about sidewalks, thinking about bike paths as streets are developed within our state. Blue Cross has been a major component of those kinds of activities. So what I wanted to give you was the context for the kind of organization we see ourselves that would promote online care and would be at the leading edge of how do we change the community at large. You can't start too young. This is another award-winning program of kids walking to school when they have that opportunity. And certainly you've all seen our Do campaign, built around activity, taking action, and getting involved to change the course of health and healthcare in the country. And I'll leave you with that. Thank you.